in my 20 years at the state Medicaid agency, one of the things that I was most proud of was implementing the statewide Medicaid managed care program that is the program that is in place today, and which is the reason why most of you are here today. And the thing that is best about that system is it allows us as a state to drive innovation and better outcomes for the people that we're serving. And so it is my great privilege to have these innovators here with us today from Vheda Health and from Wider Circle to talk about the real impacts that you all are making in maternal health. And this is the kind of thing that should be getting us really excited because there's real metrics here and real lives being impacted. Before I do that though, I want to remind this group excuse me, that the state agency, AHCA, has made maternal health outcomes and birth outcomes one of its top 3 priorities in the contracts that started in February. These are 6-year contracts, and there are 3 top priorities, and one of them is birth outcomes. So this is really timely. And AHCA has backed that up by requiring the plans to do a performance improvement project on maternal health outcomes, also to do have liquidated damages and sanctions that are quite significant for the prenatal and postpartum care measures. And so the plans should be looking at this, and everyone should be working towards this in a very concentrated way. So with that, I would like to let you all get a chance to introduce yourselves. Dr. Debra Jones is the Senior Medical Director at Vheda Health. And Riaz Ali is with the Chief Experience Officer with Wider Circle. And I'm going to give you each a chance to introduce yourself briefly and the work that your organization is doing in this space. So we'll start with you, Dr. Jones.
Hi, how are you? Can you hear me?
Yeah.
Okay. I am Dr. Debra Jones. I am one of the senior medical officers at Vheda Health. My area of interest is maternal health care. Vheda Health is a full service engagement platform. It serves chronic health diseases also, but we have a great maternal health program, and that's my area of expertise, and that's where I lend support. I'm a maternal fetal medicine specialist here in South Florida. I've been here for the past 30+ years. I arrived in 1993, and I've been working to try to improve the health of mothers in South Florida. Unfortunately, I wish I had great news to tell you that we're doing a great job, but the numbers say that we have a lot of room to improve. Florida's rural community and Black women have the highest maternal morbidity and mortality rate. And Vheda Health, we're trying to make a little impact on this and improve the health of women that we serve in our maternity health program by connecting the dots and giving them a way to engage in their own health care and to improve outcome.
Good morning, everybody. My name is Riaz Ali. I'm the Chief Experience Officer at Wider Circle. Wider Circle's been around for about 10 years, and like a lot of the companies that are here working on whether it's social isolation or maternal health, Wider Circle's premise is pretty simple. You bring people together virtually or in community, and you see all kinds of things happen. Their health improves, their lives improve. Wider Circle is active in about 14 states right now. And we serve individuals on Medicare, we serve individuals that are dual eligible, and we also work with individuals that are on Medicaid. As part of the work that we do also work with individuals who need maternal care. A little bit different than Vheda Health in a complementary way. The model for Wider Circle is designed by moving upstream. How do you address some of the barriers, community barriers, social SDOH barriers, psychological barriers that might prevent somebody from engaging in their health. So I'm looking forward to the discussion. Thank you for having me.
Well, great. Let's dig a little bit more into the details. Dr. Jones, let's start with you. Vheda's model addresses care deserts and social determinants of health. So tell us a little bit about how your virtual engagement model is ensuring equitable access for mothers in rural and urban areas, and kind of what are the lessons for the plans in our audience?
Well, I think the best way to describe that is to tell you how the program works. The plan refers the patient to us. Each mother gets a cell phone, which is fully loaded. It has an unlimited data plan, and they also receive remote monitoring devices, blood pressure cuffs. They also receive glucometers as needed, a scale, pulse ox as needed. And that's just the beginning. The real magic is in the human touch. Once they're connected with Vheda Health, they're screened. Each one of them are screened for their social determinants of health. They're screened for their behavioral health and for their chronic medical and any pregnancy-related diseases that they may have. This just doesn't happen in the pregnancy portion of the program. We have a very vigorous postpartum project where we continue the services for these mothers. We continue to connect with them in the language that they prefer. We also connect the way they want to connect. Not everybody wants a telephone call. Some people like to engage with apps or text messages. We send out reminders for their prenatal visits, for any other visits to any other subspecialists like myself. So we support them throughout their journey. We also, in the postpartum period, we make sure that we're supporting them to go to their postpartum visits. They also have an opportunity to do more screening for depression, depression follow-up. We even help mothers navigate immunizations for their children. So it's a full support service, helping moms juggle what moms have to juggle. You know, not only their health care, but their children, their multiple visits, the complex, I give them very complex, detailed, what's the correct word? Thank you. Care management plans in 5 or 10 minutes, and I expect them to go home and by themselves and execute. So Vheda supports them throughout their journey.
Riaz, Water Circle is reporting a Medicaid engagement rate that is 3 times higher than the average, which is pretty incredible. I think it was the #1 complaint that I would hear from our health plans is, A, can you help me find the member? And B, how do I get them to engage? So what specific elements of your Connect for Life program are really driving that engagement success, especially among your expectant mother population?
Great question. A couple of points on that. So the first thing I'd like to say is that one of the things about the Water Circle model is that it's really powered by this notion of peer-to-peer connection. So when you're really focused on trying to get an individual, be it somebody who's newly pregnant for the second time, but early in their journey, connecting them with a community that's local to them, whether it's geographically local or somebody with shared interests. That's one of the things that we do. When you offer that, it's a different premise, it's a different opening conversation that you're having. And I think that's one of the things about the model that we really focus on. I think the second thing is, as Dr. Jones said, is you have to meet the people where they're at. You're not going to always get everybody to answer the phone. You're not going to always get them on the first conversation. So what you really have to do is you have to make sure that you're systematically breaking down whatever challenges they may be facing. The SDOH, the survey that Dr. Jones said, we do something similar as well. What we have found is that sometimes there's a disconnect for individuals on Medicaid who may be underemployed, overemployed, i.e. running from gig to gig, whose schedules are in flux, who have childcare to worry about, that they may very much like the idea of being engaged, but they can't find the time. So how can we help break down some of those barriers? How can we get them some rental assistance? How can we get them some food assistance if that's what's on their mind? So some of the levers for driving that engagement isn't necessarily in the modality. It's actually in what conversation you start out with. And then the last thing I'll say is, because I think this is something we've found, and we talked about this last week, is the difference in engagement models between local and rural neighborhoods. A program for expecting moms in Baltimore is going to look very different than if you're in Baton Rouge or in the farmland. I'm from New Orleans, in Louisiana's hometown, so that's why I'm referring to that. Is going to be different. So I think the understanding the demographics and the geographics and the psychographics of the members is really important.
So Dr. Jones, you're combining remote monitoring, but also cultural sensitivity and live support, education as well. And what kind of innovations in this technology-driven model have been the most impactful, do you think, in improving the maternal outcomes, and especially differing between urban and rural? There is a real focus in this state on rural that I've not seen over the years, and so people are particularly interested in that right now.
So let's start with the difference between the rural and the urban patient. We found that the rural patient, their biggest challenge is the digital deserts, the inability to connect with their care provider. And we found that the telephone, I call it the tech, the telephone, the ability to have access to their provider continuously through Vheda Health is a game changer for the patients in the rural areas. They have, like in Florida, for instance, this is where I'm from and most familiar with, I have patients driving 2-3 hours to see me as a subspecialist for me to review their blood sugar sheet. They don't have the broadband, or they're in digital deserts, and they can't email me their blood sugar. So they have to come with their blood sugars to see me. This is all retrospective data. It doesn't help that it's retrospective. Sometimes it's 2 weeks, 4 weeks, and that's why we have a disconnect with healthcare outcomes. With Vheda Health and the fact that they have the cell phone that works all the time, they have access to our health care support team. We get the data real time. We can set up alerts. We know the patients that need to make that trek in sooner, those people that can stay at home and still be followed with their provider. And then the critical numbers that patients may be having at home. We know that now they can get on, a long 2-hour trip from Okeechobee to Longwood, or that they might need to find somebody to help them to get there. The urban, I was thinking about this, the difference with the urban community. Urban women sometimes who have Medicaid are in deserts. Doctors don't want to see them. They're complicated, they're hard. They too have to travel to find care. Their care is usually fragmented, disconnected. They deliver here, they do their postpartum here. They have their antepartum care at another facility. And so they have an integration problem, and they have fragmented care. And Vheda Health helps with that integration. We're the constant. They're connected to us. We can get their data and information out to their care providers easily, and that impacts the outcome of these patients. But at Vheda, we like to keep it simple. Although there are two different communities, two different sets of problems, the solution is the same. Women want to be connected to the care provider. They want to believe that somebody cares for them, that there's somebody out there that they could reach out to that will have the time to take care of them and listen to them. My practice, I feel we're successful at times because we spend time with the patients, we engage them, we talk to them, we know, that their husband had a stroke or their mother is sick. And through this engagement, and I say one more thing, I've never met a mother that doesn't want a healthy baby. Most women want healthy babies and they want to make sure that they themselves are healthy. They just need the tools to do that, and the sense that we care for them. So in answer to what's best, I don't know if it's the tech or if it's the people touch, but I think the combination of both of them really impacts the outcomes. And since you guys are health plans, outcomes, as you were saying, are important, not just from everybody wants a healthy community, a healthy society, but if you don't have the outcomes, you're going to suffer the consequences in terms of payments.
Yeah. I'm so glad you started talking about outcomes. So, Riaz, as we talk about, you all are tackling social determinants of health, which I think we're all learning have some of the greatest impacts on health outcomes. What kinds of social determinants are you seeing most commonly as a need in the populations that you're serving in the maternal side, and then what kind of outcomes are you getting from addressing that and wrapping around all your other services?
It's a really good question. What I would say is that for the populations we serve in Medicaid generally, the social determinants of health that we see are, I would imagine everybody in this room would understand this, right? You're talking about financial insecurity, housing stability is what they're looking for. How that manifests itself is different, and I think the challenge sometimes is access to resources and connecting. And I think one of the things that we've found, and I would answer your question on outcomes in a little bit of a different way, which is I think there's a massive opportunity that as you're trying to move upstream and you're trying to close the SDOH barriers in order to both build the trust, but also to create the space for somebody for a mom who wants to take care of their baby, who's looking for that, but has other barriers they're navigating, is how can we better connect to the available resources? How can we make sure that individuals have the information and the ability to get that closed loop referral service? That's a lot of what we're working on. The second thing I would say in terms of barriers, not quite SDOH barriers, but Dr. Jones mentioned this in terms of care deserts. We also find administrative navigation is a significant barrier. The actual act of having to get the doctor's appointment scheduled, the act of finding somebody who will accept you, our investment in technology, and we're doing a little bit more on the member-facing side, but we've historically focused on how can we streamline the back-end experience. So we're doing some work to help, as part of our case management, to help expedite the scheduling. Now, this is not just in maternal populations. This is for anybody trying to get a PCP visit or trying to get their annual wellness visit. And I think use of technology to simplify and break down administrative barriers that prevent somebody, not because they don't want to, but because they cannot. How can you find somebody whose panel is open quickly if your PCP is closed or it's been some time between when you've gotten the care? The last thing I'll say is that we're also finding I think this is something we're spending some time working on is economic stability and job security. And this is something particularly with changes in the workforce requirements and all of these things that are coming, they're all conflated and they're all integrated. So I think how you navigate somebody who can make sure that they're making a living wage, they're able to get put food on the table, that's a big part of what we're seeing. And it's not just about referring somebody to a community program or a community CBO. That's a different kind of intervention that needs to be designed to actually address that SDOH.
So as we get to sort of the last part of this, we want to make sure that we're talking about those outcomes. So the plans, as I started with, have very significant contractual obligations to get some of the basic things done, like prenatal care and postpartum care. They are also measuring things like primary cesareans, birth weight, and so on. And so they really are tracking this closely. Dr. Jones, for you, we heard that Vheda has seen a 36% decrease in NICU admissions and a 20% improvement in delivery costs. That's incredibly significant. Can you share kind of how your real-time data and your closed-loop communication is contributing to those results?
So, yes, this is for Vheda, over thousands of maternal lives throughout the United States, and they have found this significant reduction. It's hard to pinpoint one thing that decreases the NICU admission and the cost of care. I mean, you decrease the NICU admission, you decrease the cost of care significantly. And so anything that you can do to move from preterm to term deliveries is helpful. I believe it's a combination of reaching out to the patient on this device and being there so that the patient has access to continuous care, not intermittent care just when they see their provider, but continuous care, so that you can see trends early and act upon them. The physicians are alerted about any trends, any abnormal labs. This is the closed loop part of it. In my office, I've designed an elaborate protocol trying to close lab loops. But lab loops can sit in a doctor's inbox forever, abnormal blood pressures in a doctor's inbox forever, no matter how diligent you may be, or the patient might not be engaged, and you don't know that the patient hasn't been engaged until the patient comes back to see you. So I think it's a combination of the tech, which is the phone, which allows the patient to connect with you. And I always think people power is the best type of power. So I think it's the engagement of our staff, the way they engage with the people, and the members really feel that they have a safe place at Vheda Health.
So it sounds like it's a layering of different interventions, which is probably not a surprise to anybody in this room. If there were a silver bullet, I think we would have found it by now, but kind of wrapping together a number of different things. Riaz, back to you. You all have algorithms and a member app as well, and you are creating these meaningful peer groups. And so what role is the technology playing in kind of bringing all of that together for your members that you engage with?
So let me take those separately. I'll talk about the member app first. I think the first thing I would say about it is people's use of technology varies and is shifting. One of the shifts that we are seeing, for example, is the use of a member app or something like that. When you're trying to create connection, you're trying to create stickiness, makes sense. But for something like scheduling visits, as I alluded to earlier, where the use of how many of you guys get reminders in text to confirm, right? So it's like frictionless technology essentially. So it's not necessarily the fanciest technology that's out there. It's like you got to go into the app and log in. It's how can we use technology to integrate it and reduce the barriers to usage. So I think part of how we are thinking about technology is a little bit dependent on what use case we have. In the context of creating communities, it's a little bit, I think, intuitive in the sense that it's if you're trying to create groups, finding people that you wanna associate with. If you found a group, staying connected, being able to message with them, being able to interact with them. If there are events we do virtual and in-person events, the ability to find those events and RSVP and then confirm that you're going to be there so that there's that positive reinforcement. I sign up and then somebody else sees that I'm there, they'll come back. So I think the idea of kind of a contained environment in the context of engagement, I think really does make sense. So that's a little bit about how we think about digital engagement in there. And the last thing is I will say, sometimes people want a phone call. People want to hear that voice. And it is particularly true when you are trying to address a question, because the trust barrier, particularly in the healthcare system, is so high that somebody just says, it's not enough to get that text to say confirm, I'm going to call and double check. So we do use phone quite a bit. On the algorithm side, I think it's interesting, and it's interesting to ask about algorithm right after we talk about synthetic data, by the way. So I'll just sort of point on that. We think about our data in two different related ways. One is really around understanding what's the care gap opportunity, right? So we are in service of the members, but also our sponsors and partners are health plans writ large, whether it's a maternal population or not. And so what we really want to understand is what kind of clinical gaps, what kind of SDOH gaps do people have, and understanding whether or not there's groupings and logic associated with that. So I would call it more in terms of need-based profiling and segmentation. And then the other part of it is, well, how do you get maximum engagement out of people? How do you want to group people based on geography? Do you want to group people based on interest? And that's something we constantly cycle, but we don't actually spend too much time on that other one, because part of what our magic is, when two people meet or a group of people meet, you don't know what they're going to find that's in common. And so part of that is not trying to over-engineer that. Part of that is just, you get people out there, whether again, it's a virtual group or in person, and then they start talking, they'll find that common connection, and that's a much more durable connection on which to build longitudinal engagement.
Well, we have just about a minute left here, so just in the last quick lightning round here, we're going to ask kind of what's next for your maternal health programs. Are there plans for you to expand these services, integrate new technologies, or deepen your partnerships with the Medicaid plans? And Dr. Jones, we'll go to you first, and let Riaz have the last word.
Well, I always think that we should deepen our partnership with Medicaid plans, because I think that every pregnant woman, whether she's high risk or low risk, should have the advantage of this sort of platform to connect with their health care provider. We are going to expand our services or deepen our services in line with the total maternal health initiative by having more postpartum care. We've expanded our postpartum care to 12 months already, but we are going to dig deeper and have more data where we can share that data with our health plans and bridge the gap between the policies that we are making, because policies alone cannot fix this, as we know, and we're going to try to bridge the gap between the policies and the healthcare outcome and help health plans stay in business so that they can continue to help our pregnant mothers in Florida.
Perfect. All right, Riaz, wider circle.
I would say yes to expanded partnerships for all the reasons that Dr. Jones said. I think this is one of the spaces where we have to do more, and I think there is a lot to be learned from what we have already done as a society, but there's a lot more untapped opportunity. And in terms of technology, I think this is really around, our focus is how do you create more asynchronous connection with folks so that they can feel connected even if they can't make it in person. And then, like I said earlier, how can we use technology to reduce barriers and administrative barriers in service of members getting access to care and connecting with their provider.
Well, thank you both so much for sharing what you and your organizations, what Vheda and Wider Circle are doing, and thank you all for your attention on this. I encourage you all to keep doing what you're doing to improve our birth outcomes in the state. Thank you so much.